Hey, Dr. Deb Schreibman here. What's healthy? We are. I am going to talk to you all about post-COVID long hauler syndrome because I know that there is a lot of discussion about post-COVID long hauler syndrome. Is it real? A lot of people are going to the doctor and the doctor is like, this stuff isn't even real. I don't know what you're talking about. And I think to a lot of people, it can feel like chronic fatigue. It can feel like fibromyalgia. You can get things like headaches, heart issues, blood clots, fatigue, sleep issues, depression, anxiety, lung issues, fevers that are coming and going, joint pain, muscle pain. There's a million different types of symptoms that are going on when we talk about this post-COVID long hauler syndrome. Now, I want to say also, a lot of people are talking about post-COVID jab long hauler syndrome, where they got the vaccine and they had a bunch of these symptoms as well. And I think this is really important to talk about because people are not feeling good. I have people coming into my office by the droves saying, Dr. Deb, I don't know what's wrong with me. Ever since I have COVID, my muscles hurt, my joints hurt, I'm having headaches, I'm having digestive issues. I actually had a patient come a couple weeks ago and say, Dr. Deb, I had a blood clot. I've never had a blood clot before in my life. I don't know where this is coming from or what's going on. And I think our conventional medical community, because there's maybe hasn't been enough time to do the research that they like to do, just tell people, well, I don't know if that's true. Some people are even calling it functional neurological disorder, FND, and that's really confusing too because people are like, well, what's that? And it's like that chronic fatigue, that umbrella term when they don't exactly know what's wrong with you. In my opinion, post-COVID long hauler syndrome and post-jab long hauler syndrome is real. It is not in your head. I have seen patients that have been struggling. I've seen athletes that come in that say, Dr. Deb, I used to be able to ride my bike competitively 100 miles, and now I can't even ride around my block because I am exhausted. Fatigue is another big symptom of this, and I'm exhausted by the time I get home. And I think from a functional standpoint, from a functional approach to health, this is about looking inside. It's about doing the right tests the right way to try to figure out what exactly is going on with you and what we need to do to support your body better, right? How are we going to support your health better? How are we going to reduce inflammatory markers? Because COVID-19 was really well known for having lots of inflammation. So we need to figure out, how can we reduce inflammation? How can we figure out what's going on in that gut and start healing that gut and rebalancing hormones? Because hormones are not just sex hormones. There's tons of different hormones in your body, like TSH, which is thyroid stimulating hormone, or T4 and T3. Those are hormones. They're not sex hormones. Insulin is a hormone. Leptin is a hormone. So when people think we're talking about hormones, they think we're talking about sex hormones, but we're really talking about the almost 600 hormones that we have in our body, and only a few of them are sex hormones. So, this is super important because hormones go out of whack. I have talked to women who haven't had a period in 5 years, get COVID, and then all of a sudden they get their menstrual cycle back. Weird, right? And then you go to the doctor, the OB's like, oh, I don't know. It's got to be in your brain. I don't know what's going on. What are you doing different? And so on and so forth. Here, try taking this birth control pill. That's what they want to do. Or try these pellets, or try this patch. Instead of getting to the root underlying cause of the problem. What has caused this? Okay, was it COVID? If it's COVID, now what do we do to fix what's going on in your body so these symptoms go away? Because you don't want to sleep and wake up in the morning and not feel rested. You don't want to have headaches all the time. You don't want to have heart problems and lung problems. Depression and anxiety are through the roof these days. And a lot of people are talking about, well, this started post-COVID for me. So I've never had these issues before in my life. So I don't know how the conventional medical world could tell us that there is no post-COVID long hauler syndrome. And is it even real? Because I 100% believe it is real. And I also 100% believe that if we do the right tests the right way, figure out what is going on in your body and fix that, then these symptoms will get better. And our goal is always for these symptoms to go away. So if you're one of those people and you're suffering with this stuff, don't wait. Find a functional medicine practitioner, because we know how to dig deeper. We know how to find the true underlying cause of what happened when you had COVID and fix it. I have been doing these care plans with my patients for the last year when they come to me and say, Dr. Deb, I had COVID and I have all this stuff that's lasting. And, I go to my medical doctor and there's lack of consensus and nobody knows what to do. And they try me on medications and there's side effects to these medications, instead of just really taking the time to figure out what's going on and what we need to do to fix it. So if you are one of those people and you are struggling, don't just live with it. You don't have to just live with it. You don't have to just struggle. You don't have to just be that person that is sitting in your living room or in your dining room or in your bedroom or wherever and just not feeling good. You can get help. And I have seen people come back from this over and over and really get rid of these symptoms and get their life back. Until next time, I hope this helped you a ton. Wishing you loads and loads of love and light and health and happiness. Bye-bye.
Have a question? Email us at feelbetter@lakepointwellnesscenter.com. You could always go to feelbetterhere.com for more information, and to make an appointment, call 770-974-5215.